Welcome back. It is 9:12. Now, even though it appears we are finally starting to climb out of this pandemic, the long-term damage remains, not just to our mental health, but for those who got COVID and then never fully recovered. Long hauler syndrome is a real issue. Exactly what is it and how can it be treated? We are joined by Dr. Erika Schwartz with Evolved Science to explain. She is also the author of 7 books, including Don't Let Your Doctor Kill You. Good morning. Good to have you on this morning.
Good morning. Thank you for having me.
So let's start, first of all, with what defines a long hauler and how long are these symptoms lasting after a COVID diagnosis?
So that's a very good question. You know, we don't know what causes long haul, what would make somebody get long haul versus move on and get over it. People are getting long haul usually 28 to 60 days after they had COVID and the symptoms don't resolve. We find that there are more women than men that have it, and with advancing age until 70, basically, there are more women and more women. The other thing is that if you have more than 5 symptoms with COVID, chances are you're more at the risk of getting long haul. Like if you have headaches, you have fatigue, you have hoarseness of voice and muscle pains, those are symptoms that are kind of supposedly predictors, but we're not sure about it.
Right.
A lot of it is, you know, there's very little scientific data that has come out. There are only like 2 articles. As far as treatment, we don't really know much about it. There is one study that is undergoing right now, is going on, looking at a drug, but we really don't know very much about it. There's one other thing that the CDC has noticed, that there is a connection, and they seem to have similar symptoms, long haulers, to chronic fatigue.
Okay.
So they stay tired, they have shortness of breath, but then they have stuff that chronic fatigue doesn't have, which is cardiac stuff and a lot of pulmonary complications.
Okay, so as we look at the big picture, and let me jump in here. As we look at the big picture, obviously we're still learning. We don't know what causes it. We don't, know who's going to be more likely to get it. But I do have a question as far as the treatments. So we've developed these vaccines very quickly. But what about treatments for those who have to deal with the long hauler symptoms? Is it better to try to target each individual one, since there isn't a vaccine or anything? As you said, they're trying to work on that to help right at this moment. How do you deal with it?
Well, I think we go back to prevention, and we go back to taking care of yourself and resting when you're tired and eating good food and not drinking alcohol and caffeine and bad food and exercising. That's a very important thing, because long haulers are exhausted. So like chronic fatigue, they get really tired. So you want to move. Even if you can't move, you start moving slowly and making sure you stay well hydrated. They've tried things like, the antibody cocktails from Regeneron, etc., and the plasma from people who recovered from COVID. But none of this has really shown any results yet, because the data is not in yet. So the best thing to do is really take care of yourself and not just go against what your body's telling you. Learn to listen to your body. Learn to sleep when you're tired. Exercise when you can. Eat right. Hydrate. And not stress about it, because you can't do very much about it.
Dr. Erika Schwartz, we thank you for joining us this morning. For our viewers, if you'd like more information, you can go to her website, eshealth.com. Thank you for joining me this morning. Good to see you.